Substance use disorder affects so many people, but the path to recovery is really unique for everyone. A new program in Brunswick is now available for Mainers, providing treatment that works around an individual's home, work, and school commitments. Here with us to discuss is Sweetser's Senior Director of Community-Based Services for Cumberland County, Joey Rosignol. Thank you so much for joining us. Tell us a little bit about this program and how does it help people?
Yeah, an intensive outpatient program, we call it an IOP, is designed for having structured therapeutic services embedded within it. And so it allows the person to stay in their home, stay at work, care for their family, but then target some hours out of their week to physically work on what they need to get through for their own recovery. The treatment that we start them with is a comprehensive assessment. We then do a treatment plan that's catered to their specific needs and recovery goals. And so we had done a community health needs assessment for the area, for the Mid-Coast Maine, and that was one area that they felt was lacking is substance care. A lot of folks have to leave the state, go downstate, and so we felt that it was really important, and our team has been working really hard the past 6 months to develop this curriculum, and so we're ready to bring it on.
That's exciting. I think you kind of hit these points, but maybe you can underscore what makes this different. What is different about this program?
Yeah, so it is structured. It's an evidence-based model that we've purchased that we are going, that allows them to come for 3 hours a day, for 3 days a week, for 6 weeks. So it's an intensive, it's a big commitment to someone that really wants to become sober and take control back of their lives. So again, it's structured and it's intended for that intense purpose.
How do you know, if you are someone who is struggling, how do you know if it's best to seek treatment outside of your home or maybe have it come meet you where you are? What kind of person is good for one side versus the other side of treatment?
Well, I think that that's a personal decision. It depends on your own recovery and where you're at in that. We often have our own strengths, but we also have our own barriers that get in the way a lot of times. For some, you need to be removed from your environment in order to successfully recover. For others, they can actually do that while maintaining their daily routine. And so the difference kind of is you learn skills, you build the skills that you need to be successful while inpatient, but then you come home sometimes and you didn't have the chance to apply it.
Sure.
So you're kind of struggling again at that point. So some folks struggle with that. So the outpatient model allows for you go back home and use those skills and in the moment so that you're actually using them in real time.
Oh, as I can imagine, that's probably really important. Joey, we appreciate you coming in as usual. Thank you so much.
Great, thank you.
Appreciate it.